Hey guys, I'm Peter Marquardt and I'm going to be presenting on why healthcare should be rationed in the United States. In an article written by Peter Singer in the New York Times, he describes healthcare as a scarce resource and goes on to say that all scarce resources are rationed in one way or another. In the United States, most healthcare is privately financed, and so most rationing is by price. You get what you or your employer can afford to insure you for. In the public sector, primarily Medicare, Medicaid, and hospital emergency rooms, healthcare is rationed by long waits, high patient copay requirements, and low payments to doctors, which discourages some doctors from serving public patients and limits on payments to the hospitals. Even though our current healthcare system isn't perfect, it utilizes rationing to control the overall cost of healthcare. More rationing could lead to more stable and successful healthcare system. Rationing healthcare means getting value for the billions we are spending by setting limits on which treatments should be paid for from the public purse. When public funds subsidize healthcare or provide it directly, it is only natural to try to get value for money. The debate over healthcare reform in the United States should start from the premise that some form of healthcare rationing is both inescapable and desirable. No matter a person's stance on healthcare reform, everyone can be attracted to some form of rationing. It pretty much comes down to with who doesn't like saving money. Without rationing healthcare, our country's competitiveness and standard of living will suffer. According to an article written by Michael Tanner for the U.S. News and World Report, any healthcare reform will have to confront the biggest single reason costs keep rising. The American people keep buying more and more healthcare. At its most basic, no one wants to die. If a treatment can save our lives or increase quality of life, we want it. Therefore, in the long run, the only way to spend less on healthcare is to consume less healthcare. Someone, sometime, has to say no. The author is suggesting that if American people can't begin to control all the money they spend on healthcare, someone will have to. The American people will have to take action if they wish to reform the current United States healthcare system without rationing. In George Haverson's book entitled Healthcare Will Not Reform Itself, he points out that healthcare in America is badly organized, highly inconsistent, internally dysfunctional, sometimes brilliant, almost always compassionate, amazingly unaccountable in key areas, too often wasteful, too often dangerous, and extremely expensive. Care costs in America more than it does anywhere else in the world, by every measure. The current healthcare system is very flawed and long overdue for a reform. By setting specific goals, the current healthcare system will be able to function moderately successful in the future. We spend $2.5 trillion per year for healthcare, 17.5% of the gross domestic product. Under current trends, that will increase to 48% of the gross domestic product by 2050. And at that point, government health care programs like Medicare and Medicaid alone will consume 20% of the gross domestic product. Quite simply, we cannot provide all the health care everyone might want. Without rationing, healthcare costs in the U.S. will crowd out spending on every other important function of government and society, such as providing quality education for our young, cleaning up our environment, funding basic scientific research, and protecting our nation's natural and cultural landmarks. Basically, if healthcare is not reformed, the future effects will be devastating to all aspects of society. Arguments against rationing. The three main arguments against healthcare rationing are that rationing is unfair, we need to eliminate all the waste and inefficiency in the healthcare system before we ration, and rationing will be too disruptive to society. These are valid points, but rationing is already taking place in today's healthcare system, but the government attempts to keep it covert and out of the public's eye. If the government decides to openly ration healthcare, it gives us the opportunity to devise, openly and publicly, a healthcare system that strives for fairness. Openly rationing, furthermore, will motivate the healthcare system to identify and eliminate the waste and inefficiencies within the system. Rationing has the potential of becoming a force for good. By acknowledging rationing, we will actually be able to minimize rationing. If we can figure out how to do it well, rationing may lead us to become a stronger and healthier society as a whole. Stakeholders in the issue of healthcare rationing are the providers, the payers, the employers, the patients, but most importantly, you. In George Haverson's book, Healthcare Will Not Reform Itself, he discusses how buyers could simply require their insurers and health plans to use some combination of benefit designs and educational tools to steer appropriate patients to approach connectors and appropriate caregivers. Buyers can write those steerage and functionality requirements into their purchasing specifications, and then simply ask each health plan or benefits administrator to perform. Possible solutions. Lawrence Schneiderman, a professor at the University of California, San Diego School of Medicine, wrote an article for the American Journal of Bioethics titled Rationing Just Medical Care. In this article, he writes, "My proposal would do away with attempting to enumerate what basic package of services and supplies should be covered, how often and how long, and in what age or social group, according to a politically determined list. We would choose and cover treatments directed towards achieving a decent minimum goals for each person and supported by empirical evidence, instead of just setting up healthcare coverage board that would mandate a one-size-fits-all standard benefit package. We would recognize the obvious fact that workers who perform heavy physical labor, white-collar workers, and people of varying mental abilities would have different treatment requirements. All treatments would be based as much as possible on evidence-based medicine." His article suggests setting up a system to categorize people into sections and determining the minimum sufficient treatment the person can receive. The system will not allow a patient to receive the treatment if the risks outweigh the benefits. Kiplinger suggests that someday the parties that pay for healthcare in the U.S., most often an employer, its insurer, or the government, will have to create carefully considered cost-benefit analysis for every kind of medical care that might be sought by patients at every stage of life, from prenatal to old age. These analyses will be crafted by knowledgeable experts with all of us looking over their shoulders. They will decide which therapies are effective or ineffective. They will decide whether society's limited resources should be concentrated, as now, on the last stages of long lives, or focused on improving the health of children and young adults, who have many more years ahead of them. The process will be continuous, but from it will emerge standardized, rational policies for approving or denying payment for a wide variety of medical procedures and drugs, based on the patient's prognosis and age. Kiplinger offers a complex system of categorizing patients according to multiple demographics to determine their ideal treatment plan. This system is very consistent and could actually work in the future, successfully rationing United States healthcare. In conclusion, the American way of rationing is a complex, fragmented, and often contradictory blend of policies and practices, unique to the United States. It is practiced by government agencies, private health insurance companies, hospitals, and providers in ways both official and unofficial, intended and unintended, visible and invisible. Openly rationing healthcare can save billions of taxpayer dollars that are otherwise wasted. It is in the best interest of the nation to start openly rationing healthcare. Thanks, guys.